Hi, everyone. I'm Kristy MaKieve. I'm the CEO of Healthy Rural California and as well the Executive Director of Butte-Glenn Medical Society. And just a quick overview of what that means. Butte-Glenn Medical Society has been in the area of Butte and Glenn counties for over 150 years. It was the latter half of the 1800s when organized medicine really took a strong step forward in the area, and then eventually became the Butte-Glenn Medical Society. I think it was in 1946. We celebrate our 75th official anniversary of the society as it is now called this year in 2021. So Butte-Glenn Medical Society in 2019 realized the need to establish a 501c3 as a partner organization because a lot of the grant funding that is needed to do the public health work that is a priority for both organizations was needed. And so Healthy Rural California got IRS approval in January 2020. And it's pretty amazing to talk about its evolution in such a short period of time. That's just a year and 8 months later, where we are right now. But this video is the last part in the 2021 Health Equity series that we have embarked on. And a huge thank you to Lisa Lee, who's been our intern for Healthy Rural California this summer, finishing up her degree at Chico State. Lisa has done a phenomenal job of putting together this series on health equity, as well as a lot of other projects. There didn't seem to be much she wasn't capable of handling, so we ended up giving her a lot of projects, and we'll miss her as she wraps up her internship this week. At any rate, the Health Equity series, as it is unfolding this very week in August of 2021, is 4 videos plus this one, where Lisa interviewed some community leaders who have very, great passion for improving healthcare and mental health care in the region. I was very invigorated to listen to those video interviews, and it led me to realize that I really wanted to focus on access to care and what we are doing through Healthy Rural California and Butte-Glenn Medical Society to really tackle access to care head on. The Health Equity series also includes 2 written interviews, and all of those can be found at our website at healthyruralca.org. That's Healthy Rural California abbreviated.org. And under the projects page is where we have listed the Health Equity campaign. Again, Lisa, thank you so much for making this happen. As I said, I was listening to the videos of Giovanni Trisseri of North Valley Community Foundation, Dr. Robert Bernstein, who's a global health expert with a wonderful career helping other countries with their own health equity needs. As well, Dr. Joanne Reed, who runs a pediatric rural health clinic in Willows, which is Glenn County. And the 4th interview with Shelley Brantley, that got confused in my brain, with the about how tobacco smoke and smokeless tobacco further reduces health equity in our communities, especially in the rural communities of California, which is her RISE program that she leads. So those interviews were just amazing. And each one of them mentioned access to care as being a huge barrier to achieving health equity in our communities. And I thought, I better expand on what that means. What does access to care mean? It means that there is a shortage of healthcare providers in the area. As I mentioned, we come from Butte-Glenn Medical Society, so we tend to have a medical focus first. And so when we talk about access to care, we often think in our small world of not enough doctors. But it's a little bit more complicated than that, right? Access to care means that there's a problem with certain specialties of medicine. So after the campfire in 2019, I had just started with Butte-Glenn Medical Society, and we were sort of calculating the number of doctors that had left the area. I was fielding a bunch of phone calls from the community seeking largely a primary care physician who would take these new folks on. You have to understand the healthcare infrastructure that had existed in Paradise was good, and it was suddenly gone after the campfire. And about 10,000 or so, give or take a lot, that's just a rough estimate on my part, of the 26,000 residents who had been in Paradise and Magalia and that surrounding area and had lost their homes. About 10,000 of those folks came into Chico and Oroville and impacted the healthcare infrastructure there. So we were sort of just dealing with this massive displacement, both of the healthcare professionals out of the area, as well as the change in the healthcare infrastructure, and then this enormous amount of people now coming into the cities that were having to take their neighbors in, basically. The housing, of course, was a huge issue, but when you talk about healthcare, that was just an enormous loss of doctors from the area. But as we started to filter through all of it, there were so many calls for a dermatologist at that time. And then when I started, there was talk about the need for pediatricians. And I think that's sort of been resolved. But when you talk about there's not enough doctors, it may also mean there's not enough in one particular specialty. And when I look at the region beyond just Butte County and Glenn County, up into the what's called the Superior region, which are the 16 most northern counties of California, it's a patchwork of payers. The insurance companies that are in the area are limited, and they differ depending on the county within those 16 counties. And then there's also just some independent hospitals, independent clinics. There's not a lot of large healthcare systems as there are in the urban areas of California, which we often think of like the Bay Area or Sacramento even. And then of course, LA and San Diego. There's just lots of giant health systems that can, that have the resources to recruit, retain physicians and nurses and other healthcare professionals. So the access to care issues in the Superior region of Northern California are very complicated. There's a shortage of dentists, there's a shortage of psychologists. So in 2019, Butte-Glenn Medical Society established our residency task force to look at what it would take to establish a residency program. So in the medical world, the most effective way to change access to care issues is to establish a residency program, a medical residency program. And we first and foremost said, thanks to many contributions of people who've been in the area for decades and know full well, it's like nobody's ever challenged this, but we made our first priority a psychiatry residency. And what would we need to do to make that happen? And then the next priority, once we get through the psychiatry residency, would be some sort of primary care, which would be family medicine or internal medicine, whatever a future feasibility study would let us know is needed and most plausible in terms of making it happen. So we had a feasibility study done for the psychiatry residency in the spring of 2020, and that indicated Healthy Rural California as the organization that would become the sponsoring institution with ACGME that would then lead the psychiatry residency program as a consortium model. It's a different kind of model than what most people think about, which would be there's a medical school and they send residents, and then the residents go back to the medical school and rotate elsewhere. There's a bunch of different sort of like rural tracks and different kinds of ways to establish a medical residency program. we chose, because of this massive access to care issue, we, through this community-led feasibility study, said we want to have our own program in our community of Northern Butte County in order to address access to care issues. And so what's planned is that, or is still being developed, planned with our DIO, Dr. Theodore Zwerdling, our program director, Dr. Eric Peterson, who's with Behavioral Health Butte County, is that by match day in March 2023, we will start receiving our first cohort of psychiatry residencies. So from right now, it's August 2021, and just 2 years from now, we will start having psychiatry residents coming to our community. And why is that important in addressing access to care is because it's proven, there's data that shows that if a resident comes to an area, there's like a 50% chance that they'll stay in the area. So we've had a terrible time recruiting psychiatrists into rural communities in general. They are more likely to go to an urban area, but that may be because there is no psychiatry residency north of Sacramento. There's a giant territory called the Superior Region of Northern California with 16 counties, and there's no psychiatry residency in that huge territory. It's a massive space. And so we're really excited to be the engine that brings in this psychiatry residency and then whatever future residencies, at least to support the feasibility study, to then support where that primary care residency would exist. So it's kind of access to care is just a really big, complicated issue. It's a massive problem in a massive territory. There are very few other residency programs in this region. There's a family medicine program in Redding, and then one that's up in the Humboldt-Del Norte area. So what more can we do? What more can we do as a region to, determine and help bring those residency programs to life? What more can we sustain? Maybe this will be it, but when you're talking about access to care in this region, it needs to be not just a county by county sort of driven effort. It needs to be, okay, well, we don't have a lot of rheumatologists in the area, so what can we do to recruit them? And is a residency program going to be an effective way to do that? So talking about access to care also means that you want to retain your healthcare workforce in this area. And I'll tell you, as I sit here today in August 2021, we are experiencing our 6th disaster in 5 years in Northern California. I don't need to tell those of you who live through it what those disasters are. We all know them, count them off in our sleep. But for those of you who are not familiar with this area, there was the Oroville Dam spillway failure, which led to an evacuation, followed by the Camp Fire, which happened in November 2018, but then was like a year-long recovery, and still actually recovering here in 2021. Then we had the pandemic of 2020, which affected everybody. But in addition to that, we had the North Complex fire, which was last summer in 2020. And then this year, the pandemic continues. We have the Dixie Fire, which is enormous and just doesn't seem to ever really stop, just burning down towns in Northern California down. And something that's lesser known and not quite getting the attention as the fires are the drought issues. There's severe drought issues. There are homes and businesses that are getting water through wells, and those wells have dried up. So now we have families and businesses unable to have water for their people and their crops and their animals, farm animals. So it's been a heck of a time. So what can we be doing to keep the healthcare workforce that's here? There's an application that's due next week, and we're looking at partnering with a wonderful organization to bring some funding in so that we could do a 3-year resiliency and wellness leadership type training throughout the region. We have a Be Well program that's with Butte-Glenn Medical Society, and that has been going on since after the Camp Fire. So from 2019 until now. We went virtual with it in 2020. So just retention of those who are here is very, very important to us. And then the other is pipeline development. So how do we cultivate youth in the area and young adults as they are pursuing their careers? So there's a lot of wonderful work that I see, is particular in Chico. We have an incredible nursing program at Chico State. We're looking forward to partnering with them and seeing what's possible to expand, hopefully, their program, but mostly to support their rural simulation center, which is an essential part of their curriculum. It's an accredited, wonderful program. And it looks like the facilities could use some increase in funding, and sort of this building that we have a concept for, which is called the Health and Technology Education Center. That might be a great home for the simulation center and upgrade all of its facilities, perhaps even sort of telehealth certificates in coordination with Chico State. So we're looking at a lot of workforce development. The psychiatry residency is as well workforce development, right? We're adding more education programs in the area to recruit people. And then, of course, inspiring youth to pursue medicine. It's a big journey. It's a big hill to climb, but there are plenty of students who may aspire to that. And statistics show that they're more likely to come back to their home or this area to serve and be a physician. Lots of pipeline development for nursing already in place through the community colleges. And then there's a whole range of other healthcare professionals that are needed. So what more can we be doing in Healthy Rural California to support workforce development for psychologists, for dentists? I mean, there's such a need. And so why not help develop those folks from the area to pursue those healthcare professions? So those are the 3 main ways that an area would consider tackling access to care, this complicated, long-term, chronic, systemic issue. Recruitment, retention, pipeline development. And I'm really proud and honored to be working with Butte-Glenn Medical Society and Healthy Rural California to make those changes for the future. They're long and challenging and multifaceted in the work that we do, but we are moving forward. And I'm very proud of this too, because with each of the disasters, there's an impact that's negative on the healthcare infrastructure. And as I described earlier, there's a lot of independent hospitals and smaller clinical facilities doing wonderful work, but with each disaster, they're responding to that situation as opposed to building for the future. And so I see Healthy Rural California and Butte-Glenn Medical Society is taking that on and striving to address access to care concerns and issues that are critical in order to help the region of Northern California reach some sort of health equity that might not be possible without having the correct ratio of healthcare providers to patient needs. What more can we be doing with telehealth infrastructure to ensure that patients don't have to drive 3 hours for certain care needs or an hour and a half for certain care needs? You know, it's if you're an elderly patient, you shouldn't be driving very much. So why are we establishing systems where the patients then have to drive a great deal? So what more can we do in that space? So just wanted to wrap up the health equity campaign that we are doing in 2021. Who knows what we'll be able to do in the future? We'll be looking for interns and then of course the Graduate Medical Education Committee, the work that we're doing. We'll be hiring a program coordinator to help really be that front person who works with the residents, recruits them, and then gets the word out that we will be looking for folks in Match Day 2023. So good stuff happening. And again, thank you to Lisa for taking this health equity concept that had been rattling around in my brain and really bringing it to fruition. So enjoy those other interviews that Lisa did. They're wonderful people with great insight, and thank you all for making your effort to achieve health equity for everyone in our communities. Thanks so much.